Welcome to Quality Inside Chat. Great to be with you again this morning. Look, just a quick update this morning, and it's more to do with resident profiling. Shortly, we'll see an increase to the Maximum Permissible Interest Rate, or the MPIR. This will sit at 8.36% from the 1st of July. So there'll be plenty of information around how this is going to impact upon the prospective resident from the 1st of July, and there'll be some great articles written by a number of people, including Rachel Lane, on how that incoming resident to aged care, what they can do and what that means when these interest rates go up. But I want to concentrate more around what's the impact upon the care home. There will be implications for the care home, and they're not all negative or positive, but just the facts of where it is. So the rate is only going to apply to those new residents entering into care from the 1st of July or entering into a new agreement. So that's really important to understand that. It's not for existing residents that have been in their room for the last 18 months. This MPIR update has no effect upon them. But if they choose to move facilities, potentially even move rooms under their own request, they can be charged the extra interest rate if they're under those certain terms. It's only going to impact upon a high means resident. So those that aren't that familiar with aged care, really from an accommodation assessment point of view, you're broken into 3 categories, and they're generally to do with your means. So those that have got a designation of a high means or a non-supported resident, if you like, is some of the vernacular that's used around the place, it will impact upon those people. It'll also only impact those that choose to pay a DAP or a RAD-DAP combination. So DAP is the daily accommodation payment, and the RAD is the refundable accommodation deposit. So those people that are coming into care and they're opting to pay a DAP only, they'll be charged a higher interest rate than potentially their neighbour that entered care a year ago, which was around 4%. So we've seen the MPIR climb double plus over the last sort of 12 to 18 months. So there is some staggering differences in that accommodation pool or revenue pool, if you like, for the care home. One thing that will need to be considered as people entering into care and they opt to pay for DAP only, whichever way, they're still going to have to be strongly encouraged to go and seek aged care financial advice. We've also got some providers out there that are wanting people to pay a RAD. This higher DAP could mean a higher operational income. So there will be consideration around the resident profile and what you choose to do as a care home as those people are coming into your care. For those providers that who are full and have been for a long period of time, this is when they're going to be looking to maximize their resident profile. And I'm not talking about everyone of no means or low means or concessional residents being excluded from care homes, because there will still be a need not only morally to place those people, but financially there's incentives to place people in under that category. But there will be certainly a longer scrutinised period as people are coming in. So what that will mean for the sector is there could be a delay in the assessment pieces. And resident profiling isn't just about ANAC too. So there's a lot of focus around ANAC and how to maximise funding in that and come to terms with that. But ANAC is, as we know, has other strings attached around care minutes and what sort of ratios that will be applied over that. Whereas MPIR and accommodation revenues are strictly all coming into the maintenance and the improvement coffers of the aged care home, and does supply a little bit of profit to the care home too, to be fair. What's that going to do? It's going to create pressure on the hospital network. So as these resident profiling pieces get put together more, look, the MPIR has been high for a little while now, so the smaller increase it's been is not exactly going to turn a massive tap on in profiling, but it needs to be considered quite heavily, and care homes will be doing that and are doing that. So that could even cause an extra day's delay on admission from a hospital, which needs to be considered. And it's mainly because the admission pathway has slowed down. It's because there's gathering of the correct information coming to care. We've spoken about that on a couple of other clips, that the care home provider is looking for more information so they can profile in the assessment, clinical assessment piece much better. There'll be a lot more scrutinisation also around the financials coming in. Debt in care homes has never been so high. in speaking to a number of care home providers, debt is becoming a real issue, and it's mainly because there hasn't been a lot of focus around resident profiling. So as I mentioned before in similar clips, Quality Insights have seen this issue, and we've actually started developing, or we have developed training courses and developed software to support the industry on how do they actually tackle this problem. We're not subsidized by anybody else. We strictly self-fund all this sort of thing. So it's not as if we've been given a grant to go and work on this sort of stuff. We've seen the issue and we've reacted to it. And that's where we've developed things like Carebridge Portal, which complements the Bedsearch platform. This portal allows for clear communication between the health network and the provider. It removes the need for endless phone calls and misunderstandings of a patient's profile in the care assessment realm. It also has aspects of how to support the financial considerations when it comes into care. And that's where we're looking to tweak. The next part of it is how do we then get clear understanding of the financials as people are coming into care. It's fully secured. It's under a secure environment that's pen tested. So we're fully across where we need to be at in terms of data collection. But in terms of communication portal between the two parties, this will be very clear and as a traffic light system to indicate very quickly where someone is at, and really strong reporting to show reaction times to getting back to hospitals and other health networks. But also, more importantly, it tracks where these residents are coming through and how quickly. If we can improve the days coming into care for someone sitting in a hospital from 2 weeks down to a week, that's a profound benefit to that resident coming into care. It supports the hospital network and it supports the care home because they got more clarity around the information. The training courses, we've been talking about them a lot. We've had them in development and design for 3 to 4 years now. We've had them out to the market. We've probably trained well over 2,000 people through these training courses, and they are really designed at the admissions team and the salesperson coming that are bringing people into care. Yes, we have an element of fees and charges discussion, but we also just talk about how we communicate as people, how we can connect, what's the ultimate tour. We also go through those little nitty-gritty things that you need to understand when someone is sitting in front of you for an hour, how you can get across the information you need to without overwhelming somebody, how you can be really clear and concise. And the feedback that we've got from people that have taken up the training is they've been complimented in the way that they've delivered these messages. So that's really important. It enhances the reputation of the care home. It makes that first entry experience really good for the resident, and that's so important to us at Quality Insight. So those training courses are something that have been in situ for quite a bit of time, and they're well worth the effort in the teams attending. Look, it was a quick update. Thanks for watching. Look out for that increase to the MPIR. It has snuck under the radar to a degree. There has been a lot of scuttlebutt around an interest rate increase in that area, but it's coming. And it's a real clear message that aged care accredited financial advisors are just so important and vital to this industry. And there are a lot of good ones out there. I would encourage anyone in the admissions team that really are struggling with understanding a resident profile that's coming through the door to reach out to your well-known local aged care accredited financial advisor. If you don't know too many, contact us. We'll put you in touch with some. But yeah, they're really vital and they do such good work. They charge, but that money is well worth the effort that goes into it. Thanks again. Have a great day, and we'll talk soon.